Have you ever treated a patient and immediately thought, can I actually bill for this? Maybe it was a snake bite from a private exotic pet, a rare allergic reaction from bioluminescent algae exposure, or an injury sustained during an ultra-endurance adventure. These situations are happening more often than many physicians realize, and studies show that clinics lose 5 to 10% of revenue annually to preventable billing errors. That's real money slipping away simply because the system was not designed for unusual cases. How much revenue could your clinic be silently losing right now? Medicine is evolving faster than billing systems. Patients are traveling farther, taking more risks, and encountering environmental exposures that were unheard of a decade ago. Clinics are increasingly seeing injuries from exotic animals, respiratory distress from volcanic ash, complications from toxic algae blooms, and trauma from extreme sports or survivalist training. Research shows that claims lacking proper context are denied at double the rate of fully documented claims, and on average, incomplete claims require 40% more appeal cycles to get approved. Imagine treating a patient carefully, only to see the claim stuck in limbo for weeks. Have you ever had a claim denied and wondered if it was because your documentation didn't tell the whole story? Take a coastal clinic that treated a patient after swimming in bioluminescent algae. The care was clinically sound and thoroughly documented, yet the payer initially denied the claim. Another patient suffered a rattlesnake bite from a private pet, and the claim was rejected due to missing external cause codes. Even injuries from ultramarathons or survivalist training events can be flagged as elective or non-covered. In every case, the care was proper, but the claim struggled because the narrative and coding were insufficient. Studies show that complex or unusual cases have a 30 to 50% higher initial denial rate than standard claims, highlighting a systemic gap in our billing systems. So what can physicians do to protect their revenue and reduce administrative stress? First, tell the full story in your documentation. Explain not just the injury, but the exposure, the context, and why the treatment was necessary. Use specific codes, especially external cause codes, and anchor every claim to medical necessity. Did you know that extreme or adventurous activities do not automatically make care elective? Proper context is everything. Review claims before submission, consult coding experts when necessary, and leverage technology to catch errors and suggest precise codes. Every step you take increases the likelihood of timely approval and reimbursement. Here's another question. Are your unusual claims silently draining your revenue without you even noticing? Expert insights show that physicians often fail unusual injury claims because documentation focuses on clinical details but omits context. Environmental exposures are too often treated as trivial, yet they carry the highest risk of denial. Claims are denied less for what happened and more for how it is described. Precision and clarity are your most effective tools. Handling these unusual claims is not just about money, it's an ethical obligation. Patients should never pay more simply because their injuries are uncommon. Improper coding can trigger audits or recoupments, but careful documentation protects both patients and the practice. Consider the numbers. Clinics lose up to 10% of revenue annually to preventable denials, claims missing context are denied twice as often, and appeals take 40% longer without complete documentation. Can you afford to ignore this gap in your practice? I want to hear from you. Have you had a claim denied simply because it was unusual? How did you handle it? Drop a comment and share your story. If this episode resonates, share it with a colleague who struggles with edge case billing or wants to stay ahead of the curve. Together, physicians can raise the standard, improve patient care, and protect clinic revenue. Thank you for listening to the Health Momentum Podcast. Stay curious, stay prepared, and remember, the unusual is the new normal in medicine.